But this is a little tiny baby, which will be really kind of fun to do. Hey, I'm Dr. Paul. We're about to see a tiny little baby. Babies are great. All right. Hey, how you guys doing?
Oh, hey.
So good to see you. We have got the tiniest little peanut here. Look at this, guys. This is, didn't you tell me, Dad, that you made this baby for me?
I did this specifically for you. Yes.
Isn't that great, you guys? This is the best family. This little one came how early?
38 weeks.
38 weeks. And
IUGR.
IUGR meaning intrauterine growth retardation. Do you know why it was IUGR? Nope. All right, we often don't know. And honestly, the babies that are tiny like this, let me wash my hands. I did wash them already, but I'm gonna wash them again just to be extra careful. All right.
So she was born 4 pounds 6 ounce.
Okay.
And only 2 weeks early. She was breech, growth restricted.
C-section?
C-section. And we spent 16 days in the NICU.
All right. And that was probably just trying to learn how to grow.
Yeah. So now we're 3 weeks old and bottle feeding only, and 4 pounds 10 ounces.
Awesome.
No, 4 pounds 14 ounces today.
4 pounds 14, and a week ago we were 4 pounds 10. We are up 4 ounces in 7 days. Let me ask you a question. How much does a baby need to gain weight per day or per week? Half an ounce to an ounce a day. That's the goal for parents who are wondering. And we've done more than half an ounce, not quite an ounce, so we're gonna keep pushing. The really cool thing is, how much milk have you been getting? Because you're pumping, right?
Between, I'd say 750 to 850 milliliters a day.
Awesome. That's 27 ounces or so?
Yeah, 25 to 28
Just
ounces.
pumping?
Yeah.
And you're only 3 weeks out?
Yeah.
That's amazing, you guys. So, my wife and a lot of women, when they're just pumping, have a hard time maintaining the kind of volume that you would like, which it changes as your baby gets older and bigger, right? So, we've got a little one here who weighs now, just over 4 pounds. We're headed towards 5. Hi, dear. Hi. I know. It's so hard being a star. Yeah. And you could imagine that's a little mouth, right? So if you're trying to breastfeed a preemie or a really tiny baby, you don't have a whole lot of, mouth to work with. Most women's nipples are, you're not gonna get much of the breast. It can be really difficult. That's kind of obvious, right? Oh. Now we're gonna pretend that I'm a nipple. Hey, hi there. Hi there. Hi there. And you guys have struggled with figuring out the right nipple, haven't you?
Yes, so we've tried the ultra preemie, the regular preemie, and now I'm trying a wide, flat preemie nipple, which seems to be working really well.
Oh, cool.
Seems to be helping reduce the spillage out the sides.
Yeah. So yeah, that you'll get a nipple where sometimes if you hold the bottle upside down, it goes drip, drip. If it's drip, 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 they're just gonna lose all the milk. And so you've been in tune with that. Hi, dear. It's not quite feeding time. We're like passed out here. It's like, yeah, we're not doing this, Doc. So anyway, all right, we'll do a quick little exam here. Let's take a little look. So little preemies or little tiny heads will sometimes be a little more elongated, just the shape. That's totally normal. Those of you who have had preemies know that. Otherwise, everything's just littler, but it's all the same. It's the same baby. And IUGR babies, those intrauterine growth retardation, are actually super tough. For whatever reason, the womb was a little difficult. No, it's not your fault, Mom. I know moms will go, oh, I didn't, don't worry about it. It is what it is, and you've got a really strong baby. I mean, look at the tone here, guys. See that? That head control, look at that. That's incredible. Pretty little tiny baby. I mean, that's about what you would get with a 2-month-old full-size baby. So we got a strong baby with normal tone, great skin perfusion. See that? What we call capillary refill. We push down, it blanches, and within seconds, it's pink again. That tells you the heart's pumping and perfusing the body very nicely. We're gonna do femoral pulses. which you feel right here in the groin. Hey, help us out here. There we go. We feel a little femoral pulse. So the heart pumps around the aorta all the way to the toes, and you feel for that to make sure, and I felt it nicely. And then we check the hips for hip dysplasia, which is a little maneuver here to make sure the hips don't dislocate. That's also very important. The other thing we'll do is check a red reflex. And I brought the wrong tool, and babies don't open their eyes in the bright light, so we'll go dark, get the otoscope, and take a little look here. You were opening your eyes. There they are. There they are. Ta-da! I guess you're trying to film this while I'm moving the baby. This will be really good. The pediatrician dance. You do the dip. It's a dance move, and they open their eyes usually when you do the dip. This light's too bright. Am I waking you up? The right eye's opening. I haven't got the left one. Hi, are we gonna do that next time? Maybe. We may be gonna do it next time. Sometimes I'll get a little bit persistent here, wanting to be thorough, and we'll just do the little bloop. Got it. All right, you guys, a big thumbs up for a really healthy IUGR tiny baby who's almost preemie and was in the ICU for a couple weeks just to learn how to feed and grow, and you guys are doing it. It's a job feeding a baby this tiny because they just don't have a lot of energy and force. So I think we went through it last time with the bottle, right? And it's just sort of, you get the bottle in there and then you're just sort of milking it and moving it. Oh yeah, no pun intended. All right. Oh, now you're gonna open your eyes. That was kind of funny, huh? Heard Mama. Yeah, Mama's laugh. Thanks for watching. I'm Dr. Paul. Bye, little baby. Oh, look at that. Thanks you guys.